Hey, good evening. Thank you guys all for joining me. I'm glad everyone stayed for a Tuesday evening. Um, I'm Dr. Thomas Dobbs. I'm the State Health Officer with the Department of Health. We may have a couple more folks sort of pop in as we go through this, but I appreciate the opportunity to talk to you guys about coronavirus and some of the special risks that we encounter in communities of faith and especially religious services. Want to give you guys a little bit of an overview on sort of the status of COVID in Mississippi right now, kind of what anticipated trends are, understand some of our challenges, and would really like to answer some of your questions in regard not only to, kind of where we are, transmission risk, safety protocols, and also if you have any questions about the vaccine or anything else, I'd love to be able to talk to you guys about it. Real quickly, I would like to go over just kind of where we are as a state. And if we look how we've progressed over the year, we remember that we had a pretty significant bump in coronavirus cases going into the summer. And I can also remember when the summer peak looked like it was big. And now it looks pretty minuscule in comparison to where we are now. Sadly, we've seen a pretty rapid rise over the past couple of weeks. One of the things that I want to draw your attention to is holidays. And we've seen over and over again, it's not simply a Mississippi thing, although I think it might be a little bit more pronounced, is that we tend to have difficulty when we hit holiday times. When we were coming into the summer, we actually were doing quite nicely and we're turning it down. And then we had Memorial Day and we had a pretty significant jump. And then we had a little bit of a relaxation. Then we had 4th of July and we started coming down. We had a pretty successful fall, to be quite honest. Had a little bit of a notch, maybe around the Labor Day, but not so much there. But we've seen a pretty substantial jump following the Halloween was really bad on us. We had a lot of transmission, a lot of parties and stuff, and then we also had a pretty massive jump following Thanksgiving. And as you can imagine, we're extremely concerned about a potential surge on top of a surge going through the Christmas holidays. If we look at our mortality, we had a pretty big mortality jump in the summer, and we're starting to see that again now. We have really little doubt that our mortality will surpass significantly what we saw in the summer, but we know deaths typically lag 3 to 4 weeks behind the cases, just because it takes a long time for folks to get sick and stay in the ICU for a few weeks and then they die. And you guys in the ministry who are seeing folks in the hospital have probably seen a lot of people suffer. And it takes a long time for folks either to get better or to sadly pass away. And if we look at who's at the highest risk of severe disease and death, it's important to realize that not only are older folks at highest risk of severe complications and death, and if you look at people over 65, of people diagnosed with coronavirus over the age of 65, 12% will die, which is astounding, right, if we think about it. And I'll talk a little bit about age distribution of cases, but really we see an inflection point around age 60 where we see the mortality really increase. But still, there's a significant number of folks who die at younger age groups, even some young children, although not obviously proportionally quite as much. But we have a significant number of folks in their 50s. I mean, even their 40s who will die from coronavirus. If we look at the breakdown by race and ethnicity, we can see that it is a majority of the folks who've died so far are Caucasians, and it wasn't always that way. We've actually seen a pretty significant shift away from majority Black deaths to majority white deaths. But still, if we consider male and we consider both male and female in the Black community, it's disproportionate in African Americans compared to their share of the population. And if we look at deaths overall, irrespective of sex, you can see that it is majority a Caucasian, but still 44.5% of deaths in African Americans among a group that only represents about 37% of the population. And we spent a good bit of our response responding to conspiracy theories, right? People aren't really dying. People aren't dying more than they used to, yada, yada, yada. We have 5,800 more deaths this year than we had so far in the previous years, more than 2019. And this one compares the average of 17 through 19, just to give us a stable, a more stable number. You can see how many more deaths we have, and we're already starting to kind of creep back up going into the winter. Coronavirus is now the third leading cause of death in Mississippi, right after heart disease and cancer, and it may well overtake that. So it's a similar thing across the country. So coronavirus is absolutely killing people. It's not a change in designation of why people die. It is killing people. The people who've died from coronavirus, by and large, would be here next year if they hadn't died from coronavirus. And again, it's going to be mostly older folks. Um, and what we've seen an interesting shift, and I think it tells an interesting tale. We've seen, if you look in the gray bars, you can see that early on, the majority of the deaths were, or cases were in African Americans. We saw pretty quickly, were, the majority of cases by far. But then as we went into the summer, we saw a shift, and we saw that white folks started being more a higher proportion of the cases, and that's really kind of continued. And we have several reasons to think that to understand why this has happened, but we have found that our prevention messages have found a lot more fertile ground in the Black community. We've spent a lot of time trying to work on that. We recognized pretty early that we missed the mark within the first couple of weeks. We didn't realize how bad it was in the Black community, and we in the Department of Health have invested a lot of our efforts toward health equity issues, but Black leaders have really stepped up, and we think a lot of folks in the Black community who experienced loss real early understood the severity of it, and we've seen better compliance. And specifically with mask utilization and mass gatherings, which are our biggest weaknesses. But still, there's still a significant number of folks in the African American community who are getting it consistent with the same sort of trends, and there's lots more work we can do within all populations. This is kind of a busy graph. I apologize for it, but we're going to go from month to month and show where our age frequencies are. And you can see if we start in June, you can see that this is by age. You can see that the highest frequency by age was 20 years old, and they kind of tailed off after that. And so there weren't quite as many folks. And as we go into July, we saw a big surge in young folks. August, young folks, young adults. A lot of that corresponded with the summer surge, but also with sort of back to college, back to school, which is very worrisome. And then we get into September, and it kind of moderates a little bit. But look at November. November is very frightening because we've seen a shift, less young folks, more middle-aged folks. And look how many more people who are going to be in this sort of like danger zone here. So that's going to contribute to our increased hospitalization. That's going to increase to our increased mortality rate, because we're getting more and more folks in sort of like this age range who are going to be at higher risk of severe outcomes. Worries us very, very much. This is something that we kind of thought we'd see with kids bringing it back home, and we've seen that a lot, actually. We saw a pretty common thread of young folks who had mild disease or no symptoms, bringing it home, giving it to parents, giving it to grandparents, and we're starting to see that sort of issue with young folks, teenagers, young adults, going to Thanksgiving, get-togethers and giving it to parents and grandparents, and seeing, sadly, severe illness and death from that. And if we look at what's going on with our hospitalizations, this is a real challenge because we're seeing a pretty significant bump in our total hospitalizations. And if you look at, this is our daily admissions, which has increased substantially, as you can see, but you can look how much higher we are in our total hospitalizations. The proportion of ICU patients is a little bit lower than it had been, but we are pushing up on the upper limits of what can be done in an ICU situation. And it's great talking to you guys because you know what it's like being in a hospital versus a lot of folks in general public. But right now we're in a situation where ICUs are absolutely full. We're well above that. So we were too busy in the summer, and we're above too busy right now. And a lot of our ERs are actually jam-packed with ICU patients because they have nowhere to go. We have some ICUs that have 2 people in each bed. I mean, not in each room, not each bed, but in each room. So we're doubling up ICU rooms, which we've never done that before. And we're going to have to make more extreme measures as we go through this. We actually had to institute a plan where hospitals had to admit patients whether or not they had room or not. They just got to find a place for them. We've had people die, sadly, in rural areas because they didn't have access to referrals for critical care. And so we're just basically having to basically put the pressure on our health partners to make sure that they take care of everybody as best they can. they've been heroic and doing a great job, but it did take, obviously some common coordination throughout the state. Now this is what we're seeing right now going into the winter. This is what we're seeing going into the holiday season, where we have several things that are very concerning. We know we have a lot of people coming in from out of town. We have holiday celebrations. We've been seeing a preponderance of social events that are entirely unnecessary, to be quite honest. And we've seen outbreaks. We saw an outbreak in gender reveal party recently, which drives me crazy. That's something that's totally not necessary. We've seen outbreaks. We saw an outbreak with the 103 cheerleading teams came down to Jackson to compete, and we have an outbreak from a young girl, and probably more than one, but just one we know of so far, who didn't know she had COVID and spread and exposed a ton of people. So there are things that we're doing right now that are just really worrisome, especially with the fact that our health system is overwhelmed, but also we've got a vaccine right around the corner. We're already vaccinating folks. So that's going to be the plus side, but the downside is we've got to get to the holiday season. We want to bring as many Mississippians across that threshold with us as we can. And this just shows we're already even though our ICU proportion's lower, on average, our daily average census of ICU is above the peak of the summer. And then our ventilator numbers are higher too. And this is, again, going into the holiday season where we know we're going to see a lot more cases. If we talk about what are the things that make it a high risk for transmitting coronavirus, there are several things that are very important. Coronavirus is spread through the air primarily. It can be spread through touch, but by and large, it's spread by breathing other people's air. There's two types of transmission. There's a type of transmission that happens in close proximity, basically within 3 to 6 feet. And that's what we call the droplet transmission. So basically, people breathing in, some of your local particles. But we do see super spreader events. And if you get someone who's at just the right time in their infection, they can create an aerosol mist that will fill a room with infectious coronavirus. The challenge is you never know who that person is. And that's one of the reasons why we get extremely concerned about these, indoor events of any sort where we have people breathing common air. So the things that are most important are proximity and duration. So if you're close to somebody, we say less than 6 feet is high risk, and duration more than 15 minutes. Respiratory output is very important. Singing is a high risk mechanism through which a coronavirus can be spread into the environment, and also congestion. When people are kind of bumping up together, maybe when people are kind of coming into a church service or leaving, we have people can come in close proximity. Group size is obviously important because you're more likely to encounter someone. Probably about 2% of people walking around in Mississippi right now have coronavirus and are infectious. So if you have if you have 100 folks in the room, 2 of them probably have coronavirus and they're breathing into the air. If you have 50, probably 1 of them is. It's quite plausible that you're going to see that. And if we consider movement, certainly chaotic movement is going to be more high risk, and touching contaminated surfaces. So that is important, but really, by and large, it's breathing other people's air that is the highest risk endeavor when it comes to coronavirus transmission. And if we look at religious services, we see outbreaks pretty frequently. This is just an early one as an example where we had 2 symptomatic people at a church event. They ended up, out of 92 people, 35 people got infected and 3 of them died. Very tragic. Now, granted, this is early on before we knew about safety measures, but it shows what can happen. And then you had additional cases that were transferred beyond there. If we look at other potential things that talk about how easy it is to transmit, and it didn't have to be a wedding reception, but an event, similar to that, they had 30 cases that came from one wedding reception, and they ended up having numerous cases throughout the region, leading to numerous cases and 7 deaths. So these are the sorts of things that we want to prevent if we can. Anything where you have people in close proximity, breathing the same air, touching one another, you can have this sort of problem if you're not careful. And here's one that's kind of an eye opener for the choir. We knew that singing is high risk, but they basically had 1 case, and in a single choir practice, gave it to what appeared to be 52 people, both confirmed and then probable cases. So this person was obviously a super spreader, and it was kind of a long choir practice. I think this one was actually maybe a couple hours long, but you can see how impactful it can be from one person sort of with the wrong person in the wrong time in the wrong situation can end up being a disaster if you're not careful. These are the things that sort of really worry us, and we know that you want to avoid that sort of stuff happening. So to that end, we have sort of updated our public health guidance for religious services during the holidays. This is the link down here if you're interested. We know that it's something that's very important for people. It's very important for me too. My wife and I have decided that we're gonna attend services virtually, but because most transmission occurs from individuals who do not know they're infected with COVID-19. So that's very important to consider. Most people don't know it either because they don't have symptoms, which is very common, or their symptoms are so mild that they don't realize they have it, especially young children. So that's very clear risk that we have. Just people walking in your church service are going to have COVID sometimes. Close contact to those outside the household is important. So if you're around people that you're not around all the time, this sort of mixing and mingling of people increases your chance of getting COVID. We also know that severe illness is more common in older folks. And so there's some factors that are important for us to consider as we look at holiday services. We do recommend as our primary guidance to please avoid in-person services and provide virtual services only. That's the best and the safest thing to do, and would really advise folks to do that, especially as we're kind of getting close to hopefully getting a lot of folks vaccinated. We've had a really exciting day. We've had a lot of people enthusiastic about getting the vaccine. We've gotten a lot of doses in, folks. We're at the front end of it, but the only thing that's going to get us out of this mess right now is the vaccine, to be quite honest. There would be other ways to kind of get us in better shape, but it's a tough virus, and human nature is difficult. But secondary guidance is going to be for folks who really think that they just cannot not have an in-person service. We do strongly recommend that all those who are over 60 or have these chronic medical conditions should not attend. Really, there's just too high a risk of a bad outcome for people who are over 60 or have chronic medical conditions. So we're really strongly recommending that they don't attend at all, and having a virtual option would be very important for these folks. Other things like conducting services outdoors, shortening the duration, trying to make sure that attendees stay far apart from one another, making sure all attendees wear masks at all times. One of the things that we've seen over and over again, and this is a real challenge, and it's part of human nature, is when people are around people that they know and love, they let down their guard. And especially if people want to show affection. And this is especially true in funeral services. We see it over and over again. The most dangerous thing to do in Mississippi right now is go to a funeral. We have seen funeral after funeral that came from a funeral. It's one of the saddest things you can think of that could be possible. So we know people let their guard down. And it's easy with people we know. Most people catch coronavirus from someone they know, from someone they love. And that's one of the things that's so insidious about this virus. Certainly physical contact should be avoided. Attendees should not sing. Attendees in the congregation should not sing because it's high risk. And choirs are really kind of a bad idea. Instrumental music, as appropriate for the service, is preferable. But if you are going to have someone singing, that really needs to be the minimum number of people, maybe even one, separated at least 10 feet from others, and maybe wearing a loose face covering. Singing is a great way, if you get the wrong person, to create a super spreader environment. So it's very concerning. And certainly the more spacious the location is and the more airflow is better, but still you're going to have considerable risk indoors. Outdoors is much safer, without a doubt. So, if you didn't want to have a virtual services only, which I think is the best idea, really the second best choice is a short outdoor service, which can be done really, really quite safely. And to be honest, that's something that I would personally potentially feel comfortable doing, is an outdoor service where people can spread out and have that airflow. You can have transmission outdoors, but the risk is greatly reduced. And meals are very important. And this is just something for you guys to know and to be, hopefully share it with your congregations. Beware of silent super spreaders. Most people don't know they have COVID when they spread it. So it's important for us to keep it as small as we can. Meals are another place where we let our guard down. We see it over and over again. one of the first school that had to close in August was a teacher workday, and they were in work, and they wore their masks, and they were very fastidious in their hygiene, and they were good until lunchtime. And guess what happened? Masks off, food, talking, eating, visiting, and they had like 10 cases from one meal. Had to close the whole school down because of that. They knocked out their teacher corps. It's a human thing to relax and let your guard down when you're eating or when you're drinking. There's nothing magic about food. There's nothing magic about drink that protects you from COVID. And I see it all the time. Whenever we see outbreaks and people say they wear the mask all the time, we say all the time. What about meals? Oh yeah, we take our masks off with meals. Of course we do. How can we eat without that? But COVID doesn't care. COVID doesn't care. It just tries to find those weak points and spread around. So we do have some public health guidance for the holidays, and if this is something that you guys would be willing to share, that'd be fantastic. And I can send you all of these slides if you want to. But also these are the guidelines on our website. And if you go to our Maine COVID website, this is the most prominent thing now. It's better to celebrate in small groups, those with your household members and nuclear family. Wear masks in public during the holidays, very important. And try to avoid all mass gatherings. Choose virtual services if you can. Secondary guidance, keep in mind, all indoor social gatherings must be limited to 10 or less by the governor executive order. So that's kind of the law of the land. But we do, even when we're in social gatherings, we do want to be careful and stay away from folks. I have seen my in-laws and my parents, I think once in the past 6 months, and we met outdoors. We ate outdoors and we stayed apart. I don't want to take out my dad. He's 77. He's got some medical issues, and it would be real easy for me to not know I have COVID and give it to him. And I just couldn't forgive myself if I was just careless and thought, well, this time's okay, and give it to him. Those are the sorts of things that worry me on a regular basis. So this is me getting my flu shot. And I think that we have in our attendance, Dr. Fuqua, who was one of our inaugural 5 who had the vaccine. That's me, that's Dr. Fuqua. Dr. Mina, you can see his shoulder from UMC, Dr. Byers, epidemiologist, and Jim Craig, who's our senior deputy and deputy incident commander for the COVID response, went ahead and got our COVID vaccine, and it didn't hurt. And I sat around for a day waiting to feel crummy, because what I'd read in the studies is that sometimes it makes you feel achy or fatigued or something. I felt nothing, not any of it. I talking to everybody else who's had the vaccine, I think that the potential sort of side effects that they listed were probably, not that they're overblown, but maybe they were maybe hyper acutely aware of whatever minor things. But everybody I've talked to has been extremely well with it. I've said it's kind of analogous to the, I thought it was going to be analogous to the shingles vaccine or maybe the pneumonia shot, because if y'all have had it, it makes you feel kind of a little bit sort of achy for a day or so while your immune system's cranking up. But I didn't have any of that. I do suspect I might have some with the second dose, and I welcome it. Having a little bit of that is minuscule compared to the real risk of COVID. Not only the real risk of COVID to me, which is not inconsiderable, but the real risk of what I can do to my family and the ones I love, or the people in my work environment, if I unknowingly spread COVID to them. And that is all I have. So thank you all so much for being willing to listen to me and to see the information that we wanted to share with you guys. I would very, very much be interested in hearing any questions that you have, or any comments, or anything we can do to help in all the work you do with your ministries. And you can put it in the chat box too, if you'd rather. If you're on the phone, if you hit *6, I think that'll bring you out. All right, so Dr. Fuqua, I'm going to call you out. Tell me about your vaccine experience.
Thank you, Dr. Dobbs, for the opportunity. My vaccine experience was very much like yours. The shot did not hurt. I was really surprised. I know many of you have probably had a vaccination where, or a shot, whatever the medication was, where it burned going in. But the COVID-19 shot that we had was Pfizer, did not burn. And then I experienced just a little bit of soreness, but I don't think that is a side effect. Every time I've received a shot, my arm has been sore. So that shoulder muscle was sore for a day, and then nothing else to speak of. So it was a very pleasant experience considering no ill effects. And I'm looking forward to getting that second shot on or around January 4th. I have plenty of people tracking my progress to see what happens with me. So I'm really in tune to what's happening on a day-to-day basis. Thank you.
Yes, sir. Bishop Sage.
Yeah. Hey, Dr. Dobbs. Thank you for this. This is really helpful. And I think it's information we've all heard before, but it really helped hearing it again in this context. My question is about really more looking forward. After the first of the year, all of our churches are going to begin looking to the spring and really into the summer, and we're going to begin looking at vacation Bible school programs and camping programs and stuff like that. And most of those will kick off as soon as school lets out, early June, late March, May, that kind of thing. What kind of climate do you project that we might have at that point? Or as we begin to plan for that, is it realistic to be planning for that given where we might be vaccination wise?
No, I think that's a legitimate question and a legitimate possibility. So far we have activated the vaccination effort for healthcare folks, and so we've gotten those doses rolling out. But one of the more important things that has started to happen is we've allocated 60,000 doses for people in long-term care settings. So our most vulnerable people, nursing homes, assisted living, the folks who are most likely to die and the most likely to require hospital resources. I think we're going to be able to sort of, hopefully, if we can get a good vaccination effort, have a protective sort of barrier for those folks, and that's going to help immeasurably. And then we're going to go to the people 75 and older, and protect those folks. And then as we sort of build out layer after layer of immunization, we're going to start inching towards the herd immunity threshold, which is about 70%. And even if we get that, it's not that we won't have outbreaks. We just don't have this sort of tidal wave of COVID sort of sweeping over us season by season. So I'm hopeful that we can have maybe a safer but near normalish Easter. So that I'm not sure what date it is going to be, but maybe mid to late April. I would hope that we could be in a lot better shape than we are right now. It's hard to say for sure, but that's my hope.
But realistically, we're going to have to really watch this one day at a time.
Yes, sir. Absolutely.
Between now and then. Okay.
Yes, sir. Absolutely.
Thank you.
Yes, sir.
Yeah, you mentioned Easter. Looking back, the risk level now compared to then, what would you say it is?
Way worse. Way worse. The back then, I would do sort of estimates of the proportion of the population that was actively contagious. And back then, it was probably about 0.5% of people might be actively contagious. And so we're looking at about 2%. So I think it's about 4 times higher. I mean, that's a real back of the envelope sort of thing. But we were a lot more scared back then. And we're less scared. We're scared in the wrong ways, right? We were too scared then. We didn't have protective stuff. And now we're not properly scared on, people. Well, I don't want to get into it, but with some simple stuff, especially in public, we can do pretty nicely, eating outdoors and wearing a mask in the grocery store, that sort of stuff where we were more scared. But some things are just going to be dangerous. Weddings and funerals are just really, really difficult to do, especially if you're talking about any significant number of folks.
And quick follow-up for churches, the outbreaks you are seeing, are they generally within the church service themselves or the extra stuff, the meet and greets and meals and stuff?
It's a pretty significant variation. We are seeing some in church. We had a pretty massive one in East Mississippi, where sadly, when the mask mandate lifted, they thought that it was safe to come out, right? And so they quit wearing masks, and they had like 50 people from like one service. So that was pretty big. So I think we have a lot of onesie twosies, sort of just a couple of cases, someone hugs or that sort of thing. So I do think the masks have made a big difference. We know how effective it is, especially if the person's contagious, but it works on both ways. And so, but the other problem that we run into is it's hard to maintain discipline, and no one wants to be the mask enforcer. I know that as much as anybody, because it's no fun, it's no fun being the grown-up in the room all the time, especially if folks are fussy about it. So sometimes it's easier just to make it impossible to fail, right? So, and that's one of the good things about virtual services, you can't do that wrong. But in places where I think they've maintained good discipline, it's pretty safe. But I think right now it's better virtual. But if it's something you just feel compelled that you just can't not do it, really would be careful about who comes in, limiting the number, and especially the vulnerable folks. We don't want to let Christmas end up being a prelude to a funeral. All right. Well, I see a couple in the chat. Let me see if I missed anything. I do have something here that asks, what information do you have on a new strain of coronavirus being found? Yeah, so there is a new strain of COVID that has been identified in England. It does seem like it might be more contagious. It's hard to know for sure. It just looks like it's the more dominant strain, and the sort of hypothesis is it's more contagious because it's sort of overtaken the previous strain. We saw that same sort of thing in the spring. If you remember, there was like I think it was the Spanish strain, and kind of being more prominent. But based on the analysis of the sequence and the biology of it, it seems like the vaccine should still be effective. But that's the other thing that's kind of dicey is the more we let this thing run out of control, the more likely it's going to mutate. So the better we can take the vaccine, do some simple stuff, beat it down, we'll be in a lot better shape.
Dr. Dobbs.
Yes, sir.
Tommy Conway, Hattiesburg.
Good to see you, sir. How are you doing?
I'm well. How are you doing?
Hey, I owe you a debt of thanks.
No, that's all right. Don't worry about that. I just want to say we really appreciate you and you being out there and all that you have done from the very get-go. And we have taken you very serious at St. Fabian. And for the last 3 weekends, we've had outdoor services only. And I'll tell you honestly, we went for 80% compliance with masks. And I'm telling you, we're getting 99% compliance, which we're very happy with. And even when it was rainy last weekend, we probably just as many people attended, but they stayed in their cars. We bought a simple transmitter. I think it was maybe $140, and they can tune in if they're in the parking lot to tune in, and it's working great for us. And for the most part, people would say, we really appreciate what you're doing. We appreciate your concern for our safety. So I think it's time for us as pastors to be leaders and to step up and to follow your example and to say to folks, hey, if it's not safe to be inside, let's not be inside. Church doesn't magically, God doesn't protect you more inside the church than inside in a restaurant. I think we have to get rid of that myth. God is watching over us, I have no doubt about that. But we need to use common sense, and I appreciate your common sense very much.
No, thank you, Father Tommy. I appreciate that. It's good to see you again.
Good to see you too.
Hey, Dr. Dobbs, this
Yes,
is
ma'am.
Mary Woodward. Actually, Lou Ann is my sister-in-law, but
Oh, wonderful.
yeah, she married my brother. He married up. But, I agree with you that I live in the Jackson area and work downtown at the Catholic Diocese of Jackson. I know Father Tommy, but I have noticed that more African Americans and people in Jackson are wearing masks. What's frustrating is people are saying, you know, we're very careful in our masses and all that. We have outside, inside only a certain amount. Each church has that designated. But then you drive by the fairgrounds and they're having a big horse show during the weekend. And it's kind of frustrating when you want people to live their faith, and yet there are other people who have the big horse shows. And so what is your comments on that?
Yeah, you know, it drives me crazy too. It drives me nuts. I think that our priorities are wrong. You know, someone sent me a kind of a scathing email about closing churches and keeping bars open, and I was like, you know, I get it. You know, if we could, if it were under my purview to kind of restrict the bars, I would do it. But it's a sad reflection, I think, of kind of our priorities, right? Parties are more important than keeping a nursing home safe. I mean, they are inextricably linked. So it's disappointing. We just keep pushing on and just try to risk mitigate, but then try to keep in there, you know, just control the things we can control, and that's what, you know, we'll just keep trying to do.
Well, thank you for all you do.
Thank you so much. Nice to meet you. All right. Well, thank you guys so much. I appreciate you all letting me keep you late on a Tuesday. I'm gonna put in here my email in case y'all have any questions or concerns about anything. So I'm gonna put it in I'm in the little chat right here. So, all right. So if you have any questions, concerns, let me know. And Dr. Fuqua, I look forward to you coming back up here. We can get round number 2. We really want to get the vaccine out to as many folks as we can. I think that's going to be our really singular best chance to get out of this and protect as many folks as we can. All right, y'all have a wonderful evening.
And thank you so much. Have a Merry
Thank
Christmas,
you.
everybody.
Thanks. Have
Merry
a
Christmas.
too.
wonderful holiday season. Merry Christmas.